I'm going to pass it on to our government program officers, William Longinetti and Amy Romero, who want to explain a little more about the Gipra, the government reporting process.
Thank you, Jeff, and thank you, Shirley. Good afternoon, everyone, or good morning, depending on where you are. Today, we will be covering the Gipra tool. We will talk about the Gipra process. We will discuss how to ask some of those difficult questions on the Gipra tool. We're hoping to have enough time for questions. We really want to ensure that we respond to all of your questions today. And please note that this presentation is specifically for the TOR program. So some of the areas that we're going to cover may not apply to other SAMHSA grants. So if you have other SAMHSA grants, please talk to your GPO in those grants. And I will be doing this presentation with my colleague, William Longinetti. And I will share my screen. I will share a PowerPoint presentation. Let's see if it works. I don't think it's. Okay, you should be able to see my screen. Can you see my screen, Jeff?
Yeah, I can see it.
Okay. Okay. So per the funding opportunity announcement, all TOR grantees are required to collect and report Gipra data. Gipra data allow us to determine the impact of the program and enables us to report on key outcomes across SAMHSA programs. So we need to tell Congress how we're using the TOR funds, what type of services are provided. There are two Gipra data collection instruments. The first one is the Gipra program instrument. Every single TOR grantee has to complete this tool. It's a one-page tool with only 3 questions. These questions are regarding naloxone distribution. And if you're not distributing naloxone, you still have to complete the tool and say no, that you're not purchasing and distributing naloxone. The second tool is the Gipra client instrument. That has to be done as an interview with the client. You cannot just give it to the client to complete it by themselves. You have to do an interview. It could also be completed as a chart review. If you have other tools that have similar information, you can apply some of that information into this tool and pre-fill all the information that you already know, but you still have to ask some of the questions that you may not know. All clients receiving individual treatment and recovery support services should have a Gipra client interview. The data is entered into the SPARS system. So this is a graphic of the program level tool. So all TOR grantees report the program level data. This data has to be collected quarterly, and it's entered into the SPARS system after 30 days. At the end of the quarter, you have 30 days to enter this information into the SPARS system. And again, the questions just cover how many naloxone kits were purchased, how many naloxone kits were distributed, and if you have not purchased and distributed, you say no, and you just submit this tool into the SPARS system. The client level tool. So this is also required for grantees that are funding individual treatment or recovery services. So if you're doing individual treatment sessions, you have to have a Gipra on those clients. If you're only funding prevention activities or group sessions, you don't have to do Gipras on those clients. So if you have a health fair or some type of event and you invite a lot of people, you don't have to do Gipras for those those clients that may not be receiving individual services. There are 3 data collection points. baseline or intake, 6-month follow-up, and discharge. The TOR program does not collect 3-month follow-ups. And you must complete a follow-up even for clients that have been discharged. So even for clients that drop out, you have to have a follow-up interview. All Gipra interviews can now be done via phone or video conferencing. A lot of you are doing telehealth, so you don't have to do them face-to-face. The baseline intake interview. So if possible, you should collect the Gipra intake data as soon as the client enters the program. So if the client needs a break, you can take a break, go for a walk, come back and continue with the interview. If you think that the client may not be in a good place, that day, they may not feel okay, you can ask the client to come back another day and finalize the Gipra interview on another day. So you have to assess the client. How is the client feeling that day? Are they able to sit down and complete this interview? It's lengthy and we know. During the intake, you have to complete sections A to G. TOR Grantees skip section H. So this is a very long section of 10 pages. TOR Grantees do not complete section H. If you have a new TOR grant, some of you were funded in 2018 and now have a 2020 new TOR grant, you have to give the clients that may be transitioning from one grant to another grant the same client ID, but you have to enter those clients into the new grant to be able to count them towards your targets of your new grant. And that is only for clients, for programs that have 2 TOR grants. Follow-up interview. If the follow-up interview is conducted, please complete sections A to G in section I. If the client cannot be found, you can do an administrative follow-up, complete only section A, the record management, in section I. And the recommended minimum follow-up rate is 80%. So please try to stay in touch with the client. If the client is no longer receiving services 6 months later, you can ensure that you have contact information to be able to bring the client back or have a call to continue with the follow-up interview. You're also able to give a $30 incentive for the follow-up interview. And this could be anything except cash. There is a follow-up window period. So to get credit towards your Gipra targets, you must complete the follow-up within the window period. You have 1 month before and 2 months after the 6-month anniversary date to conduct the follow-up interview. If the 6-month anniversary date is July 1st, you can conduct that interview from June 1st to August 30th. So a total of 90 days. If you find the client after that window period, you can still collect the data and enter the data into the SPARS system, but it will not count towards your target. So it will not count towards that 80% target. Discharge interviews. SAMHSA recommends that you follow your internal discharge policy. If your policy is that you don't discharge clients, then you don't have to do a Gipra discharge. If you are completing a discharge interview, and for example, if you discharge after the client doesn't show for 60 days, and you do an interview, you have to complete sections A to G, so ask all the questions again, and sections J and K, and those are for the discharge only. You can also do an administrative discharge if you don't find the client, and in that case, you complete section A and J and K. Addressing confidentiality concerns. So Gipra client data is de-identified. You assign the client a unique ID. We don't have the identity of the client. Only you at your program know who that client is. The same unique ID is used each time. Even if the client has more than one episode of care, And for confidentiality reasons, do not use any part of the client's date of birth, social security number. This should be just random letters or numbers that you assign to each client. Grantees must keep the information of the client confidential. All records must be kept safe and cannot be shared. So please follow your participant protection policy. Okay, I will share the Gipra tool. I gave you a lot of sections and I know those may be hard to follow. So I will actually show you what the Gipra tool looks like. Let me bring it up. So this is the Gipra tool. And make sure that the one that you have has the date of March 2019. That is the most current. So we start with a table of contents. Then this is the record management section. Here is where you put the client ID that you assign to each client. So the name of the client is not on the tool and is not entered into sparse. Then you let us know if the client is receiving treatment services or recovery services. Here you put your grant ID number. And you select the interview type, intake, follow-up, or discharge. Then we go into the behavioral health diagnosis. And we get a lot of questions about this section. So you don't have to diagnose the client when you do the Gipra interview. If there is a diagnosis that is known, you can select what that is. And there are a lot of options in this section. You can select up to 3, but there is also the option at the end that you don't know or is unknown. So let's see, let's go back down. And if you don't know if that client has a diagnosis, you can select, oh, I think I took that page out, but there is a I don't know part at the very end. And the Gipra tool gives you the option of refuse and don't know for almost every question. So you don't always have to have a response from the client for every question. And you will notice that there are specific sections also for expert grants, and those don't apply to the TOR program. So for example, he says this section is for expert grants only. Please skip those sections. Do not, those don't apply for the TOR program. Okay, then we go into planned services. And here is where you select the services that you're planning to fund with the TOR grant for that client. If you're doing case management, or you may be doing MAT or aftercare services. So let us know what you're planning to provide to that client. Demographics. This section is only asked at intake. So for the follow-up and discharge, you don't ask the questions on the demographics section. Then we go into military, family, and deployment. And here we ask questions related to if the client served in the armed forces. If the client says no, for example, then you could skip all the way to A6. So make sure that you pay attention to these skip patterns. So it seems long, but there are a number of skip patterns that you don't have to complete every single question. If a client says no, in some cases, you are able to skip to a different section. Section B, drug and alcohol use. So in this section, we're really interested in knowing if the client has used alcohol or any drugs in the past 30 days. And again, the client can refuse or can say, I don't know. So you're able to select refuse if the client does not feel comfortable responding to these questions. And this section, it's a little bit long, but you have to ask as it is written, but you're able to explain the questions to the client. Then we go into section C, family and living conditions. And we just want to know what is the living situation of that client. And if you pay attention to the instructions, it says do not read response options, do not read these response options to the client. So you just ask to the client, in the past 30 days, where have you been living most of the time? And let them respond. And based on their response, you can select an option that fits or other as well if not, none of these options fit. And you can use this opportunity if the client says, I'm homeless. You can use this opportunity to build some rapport and to also be able to link the client to needed services for like recovery housing or any type of assistance that the TOR program can provide. In some instances, you can read the responses to the client. For example, during the past 30 days, how stressful have things been for you because of your use of alcohol or other drugs? Not at all, somewhat, considerably, or extremely. So in some cases, you're able to read the response options and let them pick. Then we go into section D, education and employment and income. And here we just want to know if the client is employed, what is their education level. And again, you can use these the responses to provide services to the client to know what the needs are for that client. Section E, crime and criminal justice status. So this may be a sensitive section, so some clients may be reluctant to respond to these questions. So you can reassure them that this is confidential. If you need to report any of this information, also be honest with the client and let them know that you may need to report this information. But in most cases, you shouldn't have to report any of these. This is confidential information. And again, we only see it in aggregate format. The Gipra tool has some cross-check patterns. So for example, we're asking the client in the past 30 days, how many times have you been arrested? And if the client says 2 times, on the next question, it says in the past 30 days, how many times have you been arrested for drug-related offenses? So the client can't say 3 times because this will give you an error on a sparse. When you submit this information and enter it into the sparse system, the system will say that the number cannot be higher than E1. So pay attention to those cross checks if you are not the same person that will be entering this information into the sparse system. And we recommend that you always do the tool, complete the tool in paper format, because the sparse does not let you save the interview until it's fully completed. So if you enter half of it and something happens, you may lose that information. So always have it on paper, and then because there may be technical issues when you submit this directly into the sparse system. Section F, mental and physical health problems in treatment and recovery. This is just about the health of the client. How is the client feeling? What has been their experience with inpatient treatment, outpatient treatment? And this is the section that I think that everybody worries about, and is the one that has the questions about sexual activity, and we understand is very invasive. Uh, Again, the client has the option of saying no, refusing to respond to this section, or say I don't know. So you can the client can always refuse to the entire section or refuse to specific questions under this section. So keep that in mind. There's also the option of not permitted to ask, meaning that if the client may be a minor, or if the client may have just gone through a very traumatic event, you don't have to ask these questions. We just You don't have to be a clinician to do the Gipra interview, but we want to make sure that the person doing it is very mindful on when to ask these questions and how to ask these questions, and be able to explain all of these questions to the client. And our last section is section G. There are some questions about violence and trauma under section F. And section G, this is social connectedness. And here we just want to know if the client has some support. Do they have support from their family or support groups? What is the connection to others? And this is the last section that you complete during the intake interview. So if you're doing an intake, you stop on section G, and that's all. Section H, again, we skip this section. TOR grantees do not complete section H. And section I, follow-up status. So if this is a follow-up, you would do all of the questions from section A to G and section I. And this is just asking, what is the follow-up status of the client? Was the client located or was not located? So you select one of these options. And is the client still receiving services from your program? You could say yes or no. This section is completed by the program. So section I is completed by program staff. If this is a discharge, you would do section J. And again, this is completed by program staff. You don't ask these questions to the client. And is the status of the client at the time of the discharge? Was the client terminated from the program? Did the client complete services? So depending on what is the status of that client, you can respond to those questions. And the last section is section K. And section K actually collects the services that were actually provided to that client at the time of discharge. So on section A, you submitted the planned services. What were you planning for that client? And on section K, you let us know what actually took place, what services the client received in the number of days. So for example, the client received 30 days of case management services, or you just let us know the number of days that client received TOR funded services. Okay, so let me stop sharing. And I just have one more slide. And then I will take questions. I'm sure you have some questions. Mm-hmm. Chart is moving slow. Yeah, I don't think I'm sharing. I don't.
You want me to, Amy? I can share it.
Oh, I think I got it.
You got it. Okay.
I got it.
Yeah, we're saying this.
Okay, so that is the last slide that I have. So you're able to use up to 25% of the grant towards data collection. You can contract with an evaluator, or you can work with an epicenter and do a contract with Epicenter. You can also hire staff. We have many programs that work with peer mentors, interns. They hire staff to do the Gipra data collection and follow-ups. It is a lot of work. We understand it is hard to find clients and keep in touch with them. So you're able to utilize the grant to fund those positions. If that's something that you don't, you did not think about and you don't have it, contact your GPO and we could work with you to ensure that you are able to add those positions into your current budget. Okay, so let's see. I think the next one is questions. So I think we can take questions at this time regarding the Gipra tool or anything that I have presented so far.
I have a question.
Just to answer. Oh, go ahead, Kelly.
Is medical marijuana considered an illegal substance when we're filling that out?
So for the Gipra tool, it is, but as long as the client is using medical marijuana as prescribed, you could not include it, but usually marijuana at the federal level is illegal. I'll let Will, do you want to add anything to that?
Yeah, I think for the purpose of the Gipra interview, you wouldn't necessarily have to include that as being illegal.
Yeah, so as long as the client is using it as prescribed, I would say you don't have to include that, and that also depends on your state laws.
Thank you.
Isn't excuse me, for that, didn't the tribes have some kind of say with that on the tribe, whether it would be legal or not?
Yeah, you could use your state or tribal regulations, if it's legal or not. If it's not, then it would, even if it's medical marijuana, it would be an illegal substance if that is, if that's not legal in the state or the tribe.
And just to answer some questions from the chat, all of these forms will be sent to everyone attending after the meeting, and the recording for this meeting will be available on our website. But before we move on, it looks like Barb Schott has a question. Is that right, Barb?
Yes, I do. Thank you. I'll lower my hand. So I jumped in as the program manager to our TOR program, and we've been doing MAT services, but we've been doing them for a decade already. And then we got the TOR funding, and I've been trying to add in a case manager to do these GPRAs, and it's been over a year. I've had 2 failed recruitments. I've had to reclassify it, all these sorts of things. And because our providers and our LACs have not been doing GPRAs for so long before we got the funding, I'm finding it like pulling teeth to get them to do it. Am I able to go into the medical records and just answer what I can for the GPRAs for the ones that have been missed, for the initial ones? Is that okay to just try to get whatever I can instead of totally missing it?
Yes. Yes, so early on, we were able to get approval for TOR to do chart review. So you could go into the medical records and answer as much as you can and enter that into the SPAR system.
Okay, thank you.
You have any other questions? See a lot of questions on the chat, and we will respond to those.
Nicole, did you have a question?
I did, thank you. My question is about the SPARS system. We've had a couple of errors, and I can't figure out how to edit within there. Is there a way to do that to fix those errors, or what should I do?
Yeah, so you may have to contact the SPARS help desk to correct any data that has already been entered. So once the record is entered, in some cases, they may have to delete that record and you have to re-enter the entire record. So they will let you know, depending on, I think it's depending on the question and the type of error, they will let you know how to proceed. So please contact the SPARS help desk, but you can correct it.
Okay. Just looking at the chat, Kevin asks, given the pandemic, can we administer via Zoom? And I think the answer to that is yes.
Yes, so you can administer GPRAs via telephone, via Zoom, any platform that you may be using. So it doesn't have to be face-to-face. And that applies to intakes, follow-ups, and discharges.
Okay. And Tamara asks, how far back can we go with the chart review in terms of filling in information?
I would say you can go back to the very beginning. With TOR, we had some issues with the approval of the tool initially during the first year of our first cohort. So you can actually go back as far as you need to, as long to the very beginning of your TOR grant.
I have a question.
Yes, Krista.
When is the first intake due by?
Well, it should be done within 3 or 4 days of when you see that client, but it's really up to your program. We want to ensure that it's done at the very beginning, not after the client received 10 sessions. So We know that you may have other tools that you're using, other assessments. So I think with TOR, we recommend that you do it as soon as possible, but and enter it into the SPARS also within 7 days if possible. But again, that is up to each program, and we understand that it cannot be done on the first session in some cases.
I have a question about that. So what if the patient comes in, because we don't just do MAT, we are outpatient chemical dependency counseling. So we don't just do the MAT program. So sometimes when a patient comes in, I don't know that they're coming for the medication assisted treatment, that they're just, you know, I don't know until after I've started an intake. And so didn't use our MAT intake. So then is it within after they've received an induction and like officially become part of the program? How does that work?
Will, do you want to answer that?
Please, somebody.
I'm sorry, could you repeat the question? I was having some audio issues there.
Okay, so my question is, so a lot of times when I see a patient, because I don't see just, we're not just a MAT program, we also have regular chemical dependency counseling. So many times I don't know when someone is coming in for Suboxone treatment until I'm done with like an intake, a regular intake. So, and then I have to wait for them to get a medical appointment and stuff. So is it within seeing the doctor to receive induction, or that's
So I think it's just important to look at whatever services the TOR grant is funding. And so, you know, and trying to complete the Gipra intake as soon as possible after those services begin. And, you know, as Amy said, there's, you know, we give you kind of a window, but the idea is we want to, with that intake, we're trying to get, you know, like a true baseline assessment of the client, you know, their status at that point. So we don't want to wait too long after, you know, you begin providing whatever intervention it is that you're funding through the grant. So
okay.
You know, that's going to look different for every project. So I don't know, in your case, is TOR funding, you know, what is TOR funding?
Yeah, okay.
So if TOR was funding the counseling and not the MAT, you know, and then you do the induction and the person starts receiving counseling a month later, you know, then I would say you would wait until that first counseling session. So it really just depends on specifically what TOR funds are paying for.
Okay, thank you.
Sure.
Yeah, one thing I wanted to mention is if you're only doing referral to services and you are not funding the treatment services with TOR, you don't have to do Gipras for the clients that you're referring out if you're not funding for those treatment services. Okay, do we have any additional questions? Okay, there's a question that says, we are a new clinic. Where do we enter the Gipra assessment? We'll go a little more into detail about the SPARS system, but all Gipra interviews have to be entered into the SPARS system. And in the second part of our presentation today, we will talk about that.
This is Ed Nappy from Salt Lake City. I have just a quick question. I'm assuming that this session is being recorded for the purposes of others of our staff who might also need that information. Is that correct?
Yes, this session is recorded.
Thank you.
And it will be shared on our on the TOR website.
I have one more question from the chat. Amy, I think that you mentioned that individuals are eligible for a $30 incentive for completing a follow-up interview. Does that also apply for the discharge interview, or do these incentives need to be written into the grant?
You should let your GPO know if you did not have incentives relating to the grant. You're able to make modifications internally under 25% of your grant. If you have a very large grant over $1 million, then it's under 250,000 that you can make modifications internally, and you can add incentives. You can give incentives $30 for follow-up and discharge. You cannot give incentives for the intake interview. Okay. And there is another question. Is there a workaround for Section F? It's not very trauma informed. Yes. So again, the client can refuse, or you as the person conducting the interview could hold that section a little bit longer, or explain the questions. And we're going to talk a little bit about how to explain the questions in a way that is a little bit more sensitive. You know, try to fill out as much as possible. But again, if you think that some of those questions may not be appropriate for that client, then you can, you know, the client can refuse. And let the client know that he can refuse. Let them know that they don't have to respond if they're not comfortable responding to every question. Okay.
All right. I just want to let everyone know that we'll have another question and answer session at the end of this meeting. The purpose of this meeting is really to answer any questions that you have about this form. So up next, we have our consultants, Shirley Kane and Kathy Tomlin, to talk a little bit about how to present these questions in an appropriate and engaging way, and also putting that information to work. I can hand it over to Shirley and Kathy.
Hey, Sharon. Can you see the slides?
Yeah.
I think I'm sharing. Okay.
Yeah, we can.
Yeah, the section F is the one that we also, all of us actually had concern about in terms of how to be sensitive regarding that. And I can't see Shirley. I'm going to move so I can see Shirley because we're sharing. And Shirley and I decided that probably the most important thing is, you know, how do you present this up front in terms of developing some comfort and rapport, maybe even, if appropriate, provide a cultural activity such as smudging or doing some drumming like Shirley did with us this morning earlier. Anything that provides some culturally sensitive way of entering into Section F, particularly. My way often, because I worked with a lot of young people, is to use humor. They tend to respond to humor from an adult to kind of ease some of the tension related to some of these questions. But also just to remember that there is a refused response and a don't know response that anybody can offer if they don't want to talk to you about these questions. Shirley, what would you add?
Oh, the thing that I thought was important was even before doing the Gipra, even in the beginning, what I would do is I would give myself enough time to help them feel comfortable. So they're like, this is how I've always worked, you know, like, for example, I work with elders, and Native elders are very, a lot of them are very traditional. So you have to approach them in a certain way. And how I was always raised was to be respectful toward the elders. And like, if I had to go into their homes, you know, and they offered me something to drink, I would never refuse, because that's really a faux pas to refuse anything from an elder or even from another native. So if there's a way to figure out how to make them feel comfortable in the very beginning to establish that rapport and that relationship, I think that's very important. That's a very important part, because when you get down to the tool itself, I think it could go relatively quickly. And then just make sure that, for the parts that are very sensitive, which, is F, there's other parts too that I could potentially see as being sensitive, like for a mental health question or a housing question. There could be some embarrassment about some of that. So just be ready for that. And I would say right out the gate to just say you can refuse any question that you choose.
So before we have another slide that we'll go over, but before we do, we wanted to spend some time with you talking about preparing someone for an instrument like this, especially since it's done in such a direct manner. This is a tool that has to be done in a certain way to get sort of a common response from patient or client to client. To collect data that could be useful, not only in terms of your TOR grant, but also just in terms of your community and what would be helpful to your community. So before we move on to all of that, we were wondering about a couple things related to what you already know, what you already do, because we're assuming that some of you have been doing these and have figured out ways to make it work for your communities in terms of preparing and the sensitivity issues. So a couple of questions we have, if you would be willing to respond, is what do you do before starting this type of an assessment? And how do you engage your clients with a direct questioning type of instrument, which this is? What's the cultural sensitive manners that you use that kind of softens that direct questioning method? And what kind of response do you get from people when you're doing the Gipra? So we're curious what your knowledge and wisdom is as it relates to something, presenting an instrument like this to the folks you work with.
So this is Ed Napi again from Salt Lake City. When we first learned about Gipra and studied the information that was sent to us, we were under the impression that perhaps it was recommended that we enter the information during the interview into the electronic format, but we decided that our preference is to actually run copies of the instrument and actually record it manually first, because it seems like having a computer going create some sort of barrier between yourself and the participant. And I think the other thing that we like to do, and I think our spiritual person sort of set a great, sort of set it up nicely, right, where you can start it in a very spiritual way. But what I like to do, and it might not necessarily be the right way, is actually to tell them about myself first, to share who I am, and to put my life on the table, including some of my vulnerabilities, so that they know more about me. And, and if they would like to do the same, I like that very much.
Mm-hmm. Develop that rapport and that relationship right off, and telling them a little bit about yourself to let them know that you too are willing to offer some information to ease that any kind of pressure. Thank you. Just turn on your mics when you're ready to speak.
I just I'm pretty straight up and honest and tell them, if they would like to participate in this survey first. It's kind of lengthy. It asks some odd questions, joke around a little bit too, and let them know that they, have the option of answering or not. And sometimes the answers don't really flow, so they seem kind of out of sorts. I just kind of prepare them for what they're going to hear, you know, because it does kind of jump around. And you know, when it comes to the harder, difficult ones, just okay, this is where, you know, remember you have an opportunity to, you don't have to answer if you don't feel comfortable. That seems to help. I don't really have a lot of difficulty with getting the clients to participate. Sometimes contacting them to get them for the follow-up 6 months is the harder part, but
yeah, been there, done that. Thank you, Kelly. Other ideas? Or thoughts, please feel free. Are there any cultural practices that anyone uses specific to your community when somebody comes in or you go out into the community that you use when you're asking them to fill forms out or anything like this? Just when I worked with young people, I used to say a prayer a lot of the time before I would meet with them, that things would go well, because you never know with young people what they might say or do. And sometimes it can be kind of intrusive if an adult just asks them to tell them their birth date. So these questionnaires can get a little tricky that way. I was wondering if Sharon wants to say anything.
I was just going to say that I don't know so much about like a cultural practice, but I think that we try to have a cultural milieu where we're respectful, you know, of people's time. So trying to be in a good space where, you know, they feel comfortable and the information is in a respectful way. And they know that we'll try to get through it as the best we can and, you know, check in with them to see how they're doing with it all and just honoring their time, I guess, that, you know, we understand it's not their favorite thing because they're not really there for that. And I also sometimes will joke with people, I say, it's definitely not the thing that I most favor either, is doing the forms, but definitely required and we'll get through it. So just trying to make it as easy as I possibly can and be respectful, you know.
Yeah.
Yeah.
Yeah, being respectful of time is super important.
And making sure that you have enough time too, if you're filling out, because if you've got like, you're trying to do a big lengthy form in 3 minutes or less, you know, you're just not gonna be able to. And I find that sometimes some of the folks, like I tend to talk a little faster than some people, but I know some people that are just slow, or, you know, they like to think about their response. And, you know, and when you're in our work, everything is like move, 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 go, 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 you know, all these things. You just have to remember that people have a slower pace sometimes.
Yeah.
I don't want.
Amy, would you mind?
Oops.
Go ahead.
Go ahead, Edwin.
I was going to say I don't want to sort of like dominate the conversation, but you know, it's probably obvious to many of you that I was born in another country. I'm actually a member of the Ngāpuhi Iwi or Ngāpuhi tribe from the Taitokerau district of Aotearoa, New Zealand, where I was born. And I've lived in the US for over 40 years, and I've been fortunate enough to work with Native peoples for most of that time. And so even in a formal situation, I went in as who I am, a Māori from New Zealand. And I do believe that whenever I address a group or an individual in a formal or semi-formal or even informal situation, when I start off in my own language, it seems to break down a lot of barriers. And I'm going to be very careful here because it sets me up as telling them, hey, you know, what moves me is actually not the dominant society. What moves me is my traditional society. And even if people are not fluent in their own language, they still seem to be able to connect better by that. And going back to what Shirley did earlier, if you don't mind me remarking on that, Shirley, we sing. I'm an island person. We love to sing. And when you start off with a song and then go into a speech, there's something about these barriers or these uncertainties that may have existed that seem to disappear.
Yeah. Yeah. Not being part. Well, there's a comment about the feds. You know, in Indian country, you hear the federal government wants something and there's like a kind of a visceral reaction. So yeah, it's that idea of I'm not, I remember I was at a train, I'll tell a little story and then maybe a few more comments. I was at a training for Silet's tribe years ago, and there was an elder in the room, and he said, about midway through the training in the morning, he comes up to me and says, "You're not from the state, are you?" And I said, "Hell no." And he said, "Oh." And then right after that, the rest of the training went very smoothly. I didn't invite it, but he was very careful about me because he thought I was coming from the state. So yeah, just who you are and what you represent and what your intention is really important. Any final comments, Shirley?
Yes, just the one thing. I think, you know, the one statement about, you know, like collection of the data. What I've seen with some of the people I've worked with that, you know, are implementing their grants, they can utilize the data. And I think grantees, you all need to know that. That's, you can look at your own data and you can put it into graphs, and then you can present it to make arguments for additional funding, or you can use it for other funding sources. Because there's so much, I know this from my own experience working in Indian country for many years. There's so many needs in Indian country, and we're not addressing those needs in a integrated or holistic way. So I think by looking at your own data and putting it into charts, putting it into a report, or submitting it as part of your proposals, I think that's really an awesome tool to be able to utilize to make that argument for more funding in certain areas, because it shows sometimes that you have high housing rates or high homelessness rates. You know, if somebody's couch hopping, that means they're not homeless. It just doesn't fit that exact definition for homeless, but they are homeless. And then for mental health issues, it shows the need for mental health funding. So there's other things that you can show with your data.
That kind of goes.
William, do you mind presenting the next slide?
Yeah, that kind of goes towards our next slide.
Sure.
Who owns the data? And that's what Shirley is talking about, is just because this is a structured direct questioning form doesn't mean it can't be useful to individual communities. One thing that we do want to emphasize too is just this, you know, the importance of confidentiality and the concerns around confidentiality. Because tribal communities and villages can be small in number, we want to be careful, and you know, family members and relatives and cousins and aunts and uncles. We want to be careful that people's confidentiality is addressed up front, and that people understand what their confidentiality is and how their data will be collected and where the information is going to go, and then to Shirley's point, who owns the data, and respecting that by filling this out, it can help the community that they're contributing to helping others, which is a value. And then we talked about collect, you know, how to, Amy talked about spacing questions and paying attention to people's reactions, especially the nonverbal reaction. And I don't know what the last one is. Jeff, do you want to talk about that one? Making the case for budget change.
I think that was what Shirley was talking about, and using the Gipra to demonstrate what actual needs you have in the community.
Yeah, including using the data to get funding. I think that's all we have to share. Shirley, any final comments?
Again, I would just, like reiterate the nonverbal communication to really watch for that, because a lot of times it's what people don't say, but yet it's in their body language, about something that they don't like. So just watch for that, because that can tell us a lot. And our people, we do communicate a lot nonverbally. We don't communicate with words, we communicate in other ways. So just be cognizant and aware of that.
We want to thank you for taking some time to talk to us about what you're doing and how you've been able to use an instrument like this with the folks you work with successfully, and just your experience in general. So thank you for your time and discussion.
Okay. Well, thank you, Kathy and Shirley. Are you able to see my screen?
Yes.
Okay. So, hello, everyone. I'm Will Anginetti. I'm another project officer on the grant, along with Amy. And for the final part of our presentation today, I'm just going to go over SPARS. So SPARS. So you have all this Gipra data that you collect, and so now what do you do with it? How do you get that to SAMHSA? And so the way you upload that to SAMHSA is through SPARS. SPARS stands for SAMHSA's Performance Accountability and Reporting System. So it's a website that you will use and that we will use, to submit your Gipra data. It also allows you to generate reports using the data that you collect. There's trainings on there. You can generate helpful charts and ways to visualize some of your data. So SPARS, here's just a screenshot of the SPARS homepage. We have the web address up there. It's just spars.samhsa.gov. So some of you are probably familiar with this site already, but hopefully after today, we can get you going using the site. So I just have a slide or two here on how to, navigate the site. So once you go to SPARS, if this is going to be your first time using it, you'll have to get a username and password. You'll have to get it set up with a SPARS account, and we'll talk about that in a moment, how to do that. But if you already have an account, the TOR grant is located under the CSAT tab. So when you go to SPARS, to either enter your Gipra data or to run reports from your data, you're going to want to go to this tab that says for CSAT users. It stands for the Center for Substance Abuse Treatment. It's just a branch of SAMHSA. And then after that, you can either click CSAT data entry or CSAT reports or CSAT data download. So just important to note that for your TOR grant, you're going to that first tab, CSAT. And then once you click on that, and let's say you're trying to enter a client interview that you completed, you click on that tab for CSAT grants, and then you're going to click on services. So once you click on services, you'll be able to navigate to your TOR grant, and then from there you'll be able to upload your client Gipra data. And I know it was mentioned before, that we encourage you to complete the hard copy of the Gipra on paper. and then take that and upload it to SPARS. Unfortunately, you have to upload it question by question, and I know that can be time consuming, but you know, if you try to enter it directly into SPARS, there's a risk that you'll get timed out because you can't save your progress. So we don't want you to lose your information. So the safest thing to do is just to complete the Gipra interview on paper and then take that and enter it question by question into SPARS. SPARS also lets you run some reports on the data that you've entered. You know, just including simple reports about how many intakes and follow-ups you've completed. You're also able to look at the change, you know, across all your clients in some of these, you know, measures that you're collecting information on. Like, is there an improvement in substance use between the intake and the 6-month follow-up, you know, among your clients? And just keep in mind that all the data that you enter into SPARS, no one can view any individual's Gipra information. I can't look at it. No one at the federal level can view any individual Gipra interview. We can only see aggregate level data. So, you know, there's several layers of confidentiality and protection to this, but these reports will allow you to see, you know, across the 30 clients in our buprenorphine program, has there been a reduction in substance use from intake to 6 months? You know, so you can generate reports of that kind. And in order to get to the report section, again, you know, you'll go to that CSAT tab, and then on the left-hand side here, you'll click reports instead of data entry. And then you'll click on services. And another thing that you're able to do with SPARS besides running these reports is to generate charts, helpful charts using your Gipra data. And to do that, you'll click on this visualizations button, which is under the report drop-down tab. So I'm going to show you just a few examples of charts that you can create. So you know, you can create graphs using demographic data that's been entered, you know, collected on the Gipra. So, you know, it will generate these automatically based on the Gipra client data that you've collected and entered. So you have a bar chart or this pie chart, and then some tables to go along with it on demographic data. This is diagnosis data that was collected on Gipra, another bar chart and table to go along with it. So, you know, we don't want you to think that this data is just something you're doing for SAMHSA. It's also data that you can use to inform your own program and you know, improve your own efforts as well. And here's another example of a chart. This one using some of that follow-up data. So this is from another SAMHSA grant. And so it shows, you know, the blue is the intake data, the red is the follow-up data, you know, aggregate level data across several dozen clients. And so it shows you, you know, that there was a reduction in injection drug use, a reduction in unprotected sexual contact between baseline and 6 months. So, you know, showing some improvements between intake and 6 months, hopefully as a result of the services provided through the grant. So this is, you know, kind of the crux of what we're trying to get with the Gipra data, you know, through the intake data collection and the follow-up, just to try and capture the improvements in the, you know, clients' lives. And if you ever have questions, someone asked a question before about, you know, some of the data they entered, you can always contact the SPARS help desk. They are your best resource for any SPARS related questions. Their email is here, also their phone number. They're very helpful and responsive. Usually they try to get back to you within 24 hours. So as far as next steps with your Gipra data collection efforts, if you have not done this already, I would recommend talking to your project officer, either Amy or me, about the specific Gipra data collection requirements for your grant project, because everyone is doing different things, and we don't want you doing all the work to collect Gipra data if you don't have to. And so just have that talk with your project officer. And if you are going to be collecting Gipra data, then review the data collection tools, the surveys and other documents. There's plenty of other helpful documents that go along with the Gipra survey. There's an FAQs document, with a lot of helpful answers. There's a guide that gives a question by question kind of breakdown of the entire Gipra. So, take a look at those resources. And then, once you're familiar with the survey, familiar with the resources and SPARS, start collecting that information, as soon as you can, just so you're not in a situation where you're trying to backtrack, you've already started serving 10 clients, but you didn't do the Gipra. Ideally, you'll start collecting the data as soon as you start serving clients through your grant. And then anytime you have any questions about any of this, please don't hesitate to contact me or Amy. And then to get set up with an account on SPARS, you simply need to complete a form that looks like this. I know we've sent this out before. If you haven't done this already, just contact me or Amy and we'll send you this form. We probably also can send it out with the materials we hand out today. So you just complete this brief form and submit that to SPARS, and they will create an account for you. So if you have a new grant, you'll need to do this. Even if you had an old TOR grant, they need to connect your new grant to your existing SPARS account. So if you haven't done this and you have a new grant, you'll need to complete this form. And then I know we are going to distribute these slides, and there's some links here to some helpful webinars. Definitely recommend checking out the data entry webinar. I know we didn't go into too much detail about how to enter your data into SPARS, but there's already a very helpful webinar that thoroughly talks about that. So we link to that here. There's also a SAMHSA publication about completing Gipra data collection using trauma-informed interviewing skills, which is pretty helpful as well. So definitely check out some of these resources. And at this time, we can take any remaining questions. So we have a question in the chat. This is a great question. Is there a more detailed set of webinar recordings to train people how to implement the Gipra? In the old days, there were in-person trainings. Yeah, and you're right. There were longer, more detailed trainings in the past. Unfortunately, SAMHSA, we're not offering those all-day trainings right now, but there are recordings of some of those trainings in SPARS that we can direct you to. So I think your best resource, given what's available right now, is some of those pre-recorded webinars. They do go into extensive detail on how to complete the Gipra section by section. So, you can contact either me or Amy. We'll point you in the direction of those webinars. I know SPARS, there's a lot of resources on SPARS, and it can be somewhat hard to navigate. But and are they accessible to people without a SPARS account? I don't think they are, but you can request. So if you are a project director, you can request SPARS account access for all of your staff who are going to be involved in Gipra data collection. All you need to do is email that SPARS help desk and say, you know, I'd like this person to have a SPARS account set up, and they just want to know the name and email and phone number of that person, and they'll set up an account. So you can create a request to have a SPARS account created for all of your staff involved in Gipra. Is there a place to print the Gipra if we do paper format prior to electronic? Yes, so we will send out the Gipra tool today, and we'll be able to print it, you know, from what we send. And all of the Gipra documents are also available for download in SPARS, but I know it can be hard to navigate, and so we will send out a copy. And you know, if you ever need another copy sent, just, you know, you can always request that from me or Amy.
I don't see any more questions in the chat, but before we break, I just want to thank William and Amy for presenting this webinar, and also Shirley and Kathy. This was really designed to answer any questions that you had about Gipra, and if you do find you have some questions afterwards, please let us know. I also see there's another question in the chat. When using new grant, use old Gipra ID for client.
Yes. So that was regarding, we have TOR grantees that may be in a no-cost extension, and now they were awarded a new TOR grant. So for example, if the client was receiving peer recovery support services with your 2018 TOR grant, and that is now about to end, and you have a new TOR grant, we recommend that you give the client that same ID for the new peer recovery support services they will be receiving with your new grant. But you have to, and if that client will be receiving services through your new grant, your new TOR grant, then you have to enter that client into SPARS under your new grant. So your old grant will be ending soon. And that is just for applicable to the grantees that have 2 TOR grants. So we have a cohort of 2018 grantees, and a lot of them receive funding under the 2020 TOR grant. Yes, and then it says we have 300 plus clients. Does that mean I moved them all? Well, all the ones that will be receiving services with the new grant. So if you have clients that will no longer be receiving services, then you don't have to do anything with those clients. But if you have new clients or clients that are transferring to it and starting to receive new services with your new grant, then you have to have intakes, or else those clients will not be counted towards your targets of your new grant.
And if any questions, you know, come up after today, again, please feel free to contact me or Amy. You know, we're always happy to help. And, you know, we want this to be an ongoing conversation about the Gipra. And we'll be making this recording available to you all, you know, for people who couldn't attend, or if you want to, you know, look back on this as a resource. So thank you everyone for your attendance.
Right. Thank you, everyone.
Bye-bye.
Bye. Have a great day.